This morning on Public Affairs on Peach, we've discussed what autism is and how therapists go about treating the disorder. But what is it like to live with the diagnosis and do all the work to overcome the challenges of autism? Jeff Cisano has experienced those challenges. His son is 12 years old and has been a patient at Marcus Autism Center for 2 years now. Jeff, thanks so much for joining us here today. Tell me about your son, Joey.
Well, Joey was diagnosed in 2005. He is, was a wonderful kid, but at the time, he had a lot of challenges. There were things that we saw that concerned us. At 2 years old, our doctor at the well-baby visit said, I think you need to seek some additional opinions because I'm seeing some things here that are concerning speech delay, repetitive behaviors, extreme tantrums when we try to transition from one activity to another, and that's where we started on this journey.
So when you get the diagnosis that Joey has autism, what was your reaction? What was your wife's reaction?
Well, I mean, we were both shocked. Her reaction was really the stronger one. She describes it now as she just kind of zoned out. She almost, it was almost like she had experienced a severe shock to the system, and her body, in a certain way, was trying to protect itself. We had another 30 minutes after we heard the words autism that she doesn't really remember, and as well as the drive home. And it was a sadness for her. It was initially a depression for both of us because we feared that things about his life were never going to be the same. There were things that we may have wanted for him that he would never be able to have.
And is that what you found as you've gone through the treatment?
Thankfully, no. He received early intervention services at the Marcus Autism Center for 6 years, and he is doing really, really well. I think for a lot of people, if you met Joey, you might think, well, he's just a regular kid. You hardly can even tell that he has certain challenges. The areas where he's made progress, he's fully verbal, he makes great eye contact, he's interested in meeting other people and making friends. When you dig down deeper, then you start to see things where he may be interested in talking about certain subjects over and over and over again. But he has come so far from where we were, and I think what it's taught us is there's light at the end of the tunnel. Things can get better.
How did you approach treatment with Joey?
We tried to find a program that was going to be intensive. We really bought into early intervention as a way to ensure that his outcome would be the most positive. And so we had been on a waiting list at the Marcus Autism Center for a few months. He got into the program, and we dove in. Prior to that, we actually started having him in speech and language therapy from the second our developmental pediatrician, from our regular pediatrician rather, said, you want to seek additional opinion, there's a speech delay here, there may be something else. So from age 2, he was receiving speech therapy. Starting at age 2.5, he was receiving ABA therapy at the Marcus Autism Center.
And so when did you start noticing? Talk to me about the notice. You said you noticed a difference, but explain to me the difference. How did that help him in maybe some specific functions or skills?
So, things as simple as potty training. For a normally developing kid, you may go through some difficulties. If we had tried to tackle that without some of these additional services he was receiving, I don't know if we would have gotten there, maybe eventually, but it would have been a lot longer period of time. His ability to communicate with us and tell us, well, I'm feeling this, I'm nervous about this, I don't understand this. When you don't have good verbal communication skills, it's difficult for you to get other people to understand, this is a problem for me. Mm-hmm. And there's also the receptive language part, which is he couldn't initially understand what we were trying to communicate to him. So it goes both ways. Once you start going down that path, you open up those avenues, so many more things are possible, and it decreases a lot of the most problematic behaviors because now he doesn't feel a need to tantrum because something in his world is being disturbed. He can just talk about it.
We talked earlier about those expectations being dashed, perhaps, for the expectations you have for your son, but what are your expectations now for his future? What do you think he'll be able to accomplish?
I think my wife and I want him to have options. Everything that we continue to do and what we've done to this point is to try to give him options. We want him to be able to choose the things he's interested in, the kind of life that he wants to lead. If that's going to college, we want that option to be open to him. If it's taking on some kind of vocation, we want that to be the path he can choose. We want him to be able to be as independent as possible and be able to make his own decisions. For us, that's the goal, is independent living. And I think we're going to get there.
I think it's a great goal for every parent.
Yes.
Jeff Chisano, thanks so much for joining us today. Now, when we come back, hear from a parent who believes she knows the cause of her son's autism and how she's lobbying for a change in vaccinations. Stay with us.